In West Bengal, we mostly face the cases of dysentery, especially amoebic dysentery. Maybe due to the environment, local polluted conditions, and maybe many other factors. Food, water. One thing I found very important for the treatment of dysentery, that it has got power to produce some very serious psychological problem when the patient is suffering from a longer period of the dysentery. Most of the clerks, executive officers, I found them having a too much tension, anxiety before and attending a meeting or serious engagement, which is very similar to the argentum nitricum. Patient is very shy, where argentum nitricum is very exhibitionist. He wants to exhibit himself in a different manner. But post amoebic dysentery complication in the mental level is to, especially for the where patient is going to become a very shy, especially around strangers, public speaking, in front of the audience, as well as the patient, student especially, when he is going to or she is going to attend examination. The most important factor I found is severe nausea and vomiting. One, the tension and anxiety of the examination. Our next factor is to patient's family member become too much tense due to his and her severe vomiting. Sometimes may cause to the dehydration. This whole group of symptomatology, either in the past history of the dysentery or present history, continue with the amoebic dysentery. Never forget, my friend, dysentery compound. I got much, sometimes very magical result. And the patient is and family member are very much satisfied with the few doses of dysentery compound. I remember a long years ago, a lady, she is always having a very frightened nausea and vomiting. Horrible. And this horribility of the nausea and vomiting especially found before engagement, before going anywhere, especially examination. All through the whole analysis which I discussed above, I gave dysentery compound 200, taking before examination 1 or 2 days ago. But remember, my friend, we have got many examination function medicine, but dysentery compound has got its own evaluations regarding the symptomatology, especially vomiting before examination or in engagement. In Calcutta, I am facing lots of cases who have got the past history, family history of recurrent dysentery. When my indicated remedy fails, I once think tuberculinum. When tuberculinum, especially when the patient has got desire for salty things, and I prefer basilinum with desire for sweets, and many other factors also. But this past history, which is remaining capsulated in the person, and our own indicated remedy, best possible prescribing, does not give a satisfactory result. A crossroad I found very difficult to overcome. I have got many cases which give a wonderful result, medical result. If dissenting compound is not going to be covered with symptomatology, never forget, my friend, medicine tuberculinum. Tuberculinum, I note that very susceptible to cold, as well as the patient has got tremendous fear for dogs. This syndrome make me to understand post-amoebic dysentery complication in the patient where your indicated remedy is going to be failed. My friend, which I face in Calcutta, I face some problem when I used to visit Lucknow, where I got two important medicine. One bacteria, another is antimcrude. These two medicine in different areas, states of the India, I could not get much prescribing avenue. But in Lucknow, bacteria and antimcrude is thick, milky, white coated tongue, except very similar to antimcrude is only I found in Lucknow. But I like to give some more cases when the past history should remind me to prescribe, otherwise our indicated remedy is not going to be worked as per our desire.